Whether you have pain in your back or joints, surgery may not be the answer. Instead of the dangers involved in cutting out tissue, consider healing and rejuvenating the area with stem cells, platelet-rich plasma, or prolotherapy. The treatments that are available to professional athletes are now available for you. Watch the videos at jointrehab.com or call the Darrow Wellness Institute at 800-300-9300. 800-300-9300. That's 800-300-9300.
Welcome back to Living Pain-Free with Dr. Marc Darrow. Our number here in the studio for you to call right now and speak with him is 866-870-5752. That's 866-870-5752. And right now we are speaking with Ray in Los Angeles.
Ray, before I get to you, I just want to say that for anyone who calls in, which we love our callers, they get a free copy of my book, Stem Cell and Platelet Therapy, Regenerate, Don't Operate. It's about 200 pages long. It's got about 250 studies in it that show you're much better off having regenerative medicine of platelets or stem cells or both instead of getting a surgery. Unfortunately, these surgeries don't always work. I'd say there's a 50% chance it's going to work. And when it does work, it can unwork itself later, as poor Ray had, who's waiting here right now. So Ray called in before the break, and I'm going to just give out your story quickly, Ray, and please let me answer all these questions you've already given us. Ray is 55 years old, and he was lifting something heavy, and he thinks that he cracked a vertebrae then. He heard a pop and had a bone density. It shows that he's got osteoporosis. He's had 4 shoulder surgeries, 2 on each, and they're ready to do a joint replacement now on his right shoulder. And, oh boy, I mean, you know, I had a shoulder surgery also when I was in medical school, Ray, and it failed me terribly. It blew up like a balloon afterwards, and I had a high fever. And at that point, I was in training to do orthopedic surgery, and I jumped ship at that point. I thought, why am I going to do something that can hurt people? I loved my surgeon. He was my professor, but the outcome was absolutely awful. But it was really, in a sense, the best thing that ever happened to me, because at that point I jumped ship from orthopedic surgery to doing regenerative medicine. And when I learned about injecting myself, I did that. And my shoulder, I know this is crazy, the shoulder that was useless for me and painful with decreased range of motion, I injected it myself. And it was at night. I woke up the next morning 100% completely pain-free. Now,
wow.
That's not how this works for most people. I'm going to say it the way it is. It often takes a few injections over a time period. I usually have people come in once every 2 weeks. If they fly in from somewhere else, I might inject them. I did a man from Georgia who came up here, and he was from southern Georgia. I remember he was a very nice man. He said he had 1 stop sign in his town. That's it. That was the only traffic regulation. And he was here for 1 week, and he did 4 bone marrow stem cells on his knee in 1 week because he didn't have time to spend to have it done like local people do over a period. I usually do once every couple of weeks until people feel better. So I've had great success. I've used it on both my knees, both shoulders, which were both locked up, frozen, at different time periods from sports injuries. I've done my right wrist, both elbows. I've had other people do my neck and back. I've actually done Nita's neck many, many years ago. Nita, how's your neck doing today?
Great.
Okay, good. And she had pretty quick success with it.
1 week.
Terry McNally. He's on, is he still on KPFK?
No, he has a podcast. He has his own podcast, okay. Yes.
Well, you're on KPFK, right? Still?
Momentarily. Yes.
Uh-oh. Anyway, I met Terry, I think, gosh, how many years ago? I don't know, 20 years ago or so. And he had what we really do call bone-on-bone arthritis in his knee. He had when he was at Harvard, he played intramural football, had an injury, and they operated and took out his entire meniscus. He had nothing in there to cushion the bones. And when I saw him, I got an x-ray, and the femur, the thigh bone, was not even sitting on top of the tibia, the leg bone. It was off to the side. And I remember I said, what's your goals? He said, I want to be able to dance, I want to hike, and I want to do yoga. Well, we got him better. He was doing all those things. I haven't talked to him in a while. I don't know how he's doing today. But I haven't heard from him, and that is probably very good news that he's still doing well.
Right. No,
Terry,
he's
if you're
doing
listening,
well. Yeah.
Terry, if you're listening, feel free to come in again. I'd love to see you. But at any rate, what I'm saying is I feel bad for people that have these surgeries, because often they come out and then they thumb their nose at me and go, ha ha, it worked. And then 2 years later they come back and go, I thought it worked, but now it's worse. So be careful. We're moving into a new era of medicine. Things are changing. Stem cells are taking over the forefront of everything in medicine. And I have very, very good success doing it. So this shoulder replacement business, I think, is one of the worst things a person can do. I've seen way too many people after that surgery that can't even move their arm, where the fake joint doesn't fit together. Why do something that's very invasive, like a surgery, when instead you can come in and get an injection or a bunch of injections and walk out? There's very little in the way of side effects. People get a little stiff afterwards, usually for a day, day and a half, and that's pretty much usually it. Injections are easy, surgeries are hard. That's all I can tell you. So, Ray, I'd be very careful about getting a shoulder replacement. You've already had four surgeries, and I just don't see it as a way of healing the body. It's not a great thing to do, in my little opinion. I've done a lot of orthopedic surgeries in my training, and I never became an orthopedic surgeon because of my failed orthopedic surgery on my shoulder. But I still love to watch the surgeries. I have to admit, it's fun. It really is. It's a guy thing. It's a lot of fun. And, people don't know this, but typically orthopedic surgeons bring in their own rock music, and it's kind of, in a way of saying it in a weird way, it's kind of a party in there. We have a good time. So at any rate, Ray, I would not do a surgery until you at least check out regenerative medicine. If you want to call the office, the people are waiting there to talk to you, or just leave your phone number if the lines are busy. And the phone number there is 800-300-9300. Now I want to get back to the cracked vertebrae that you say you had from lifting something. You heard the pop. I'm going to bet you anything, and I can't prove it, and neither can you disprove it, that you had a fractured vertebrae before you heard the pop. And this happens all the time. When we doctors do experiments on people using MRIs, we find out that people that have zero pain at all have things like cracked vertebrae, meniscal tears in their knees, rotator cuff tears in their shoulders, herniated discs in their back. And when we show them the results, they go, but I don't have any pain, so stay away from me. Now, you may have had that fractured vertebrae for 10 years and never known about it. And then what happened is you bent over, lifted something, heard a pop in your back, which could have just been a ligament moving over a bone. And then you got pain, went to a doctor, and the doctor said, that incident caused a cracked vertebrae. Do you understand what I'm saying, Ray?
I do.
Okay. So don't ever think that when someone is injured and an imaging is done, that what they find in the imaging happened at that incident. It could, but it could not also. And we just see too many things like that. Now, the opposite thing is true also. We have a lot of people who come in with miserable pain, miserable back pain, let's say. and we do an MRI, we don't find anything wrong. So don't trust the image. I like to get the image. People come in, they say, well, you don't like images. I go, I like images, but I'm not going to use them to diagnose somebody. I like the image to make sure I'm not missing something, make sure there's no cancer or something really strange going on, because I have found cancers. People come in with musculoskeletal pain, and I'll do an image and I find a cancer there. It's rare, but I've had it happen several times in my career. So yeah, I like the images, but I don't really use them to diagnose. I use my hands and the examination and the history, to find out what's going on. So I think I covered most of your questions, Ray. The one thing we didn't talk about is your bone density. I'd love to see that bone density, and if you want to come in, bring it. You're going to probably want to do some testosterone, and what I do typically is a shot once a week. I've been doing that on myself since my mid-40s because I had was called osteopenia, but close to osteoporosis at that young age. I lost my testosterone very young. I didn't even know about it till I checked, and my bone density was horrible, and most of it has grown back over the years. I've been doing that now for almost injecting myself with testosterone almost 30 years. So with women, we give them progesterone, testosterone, and estrogen. They don't get shots because they don't need a very big dose. Men need a big dose of testosterone because we produce a lot of it. Women produce a little bit of it. So again, that's my opinion. You can go to one of my websites called myagemd.com and look up information on hormones. Personally, I think it's a necessity for people as they're aging. Men and women start losing their hormones in their late 20s. And when women go through menopause, it precipitously drops. And if women get a hysterectomy, those ovaries usually quit at the same time, even if they're left in the body. So, yeah, hormone supplementation, people call it anti-aging medicine. It really has nothing to do with aging. It just has to do with feeling great and supplementing so your bones don't demineralize, keeping the brain active. If you want to actually live longer, the only thing we know about that is using a low-carb diet, what we call a ketogenic or a keto diet or a Paleolithic diet. And I'm going to warn people if they come in to see me and they have lower extremity pain, their hips, their knees, their ankles, their toes, whatever, and they're overweight, I'm going to ask them to lose weight. So don't get mad at me. It's just that every pound on your tummy is 5 pounds biomechanically on your knees. We know that overweightness causes arthritis in the joints. So I just do my job. Don't get mad at me for doing my job. You come there for me to help you. You got to do what needs to get done. So I have a lot of
Absolutely.
my patients text. A lot of my patients will text me every single day, and they will give me their weight, and they'll tell me what they ate in the last 24 hours. The biggest reduction I've had so far is one of my best friends named Randy Garver. And Randy was 317 pounds. When he came in, he fell on his knee. And so he came in, I aspirated 90 cc's of blood out of his knee. I use an ultrasound so I can look where the needle goes and get every drop of fluid out. And I said, go home and get a knee replacement. His knee was awfully beat up. And he said, no, I don't want to do that. I want you to fix it. I go, I'm not going to do it because I'll be a failure. You weigh too much. And he goes, I'm not getting a knee replacement. What do I need to do? I said, go on a ketogenic diet. Randy has texted me every day since that day with what he eats and what his weight is. And he's down, I think, yesterday to 230 pounds from 317.
Wow.
Wow.
Yeah.
Is right.
And you know what's cool about Randy? He goes, Mark, I don't do this for you. I do this for spirit. To be an example and to be a leader and to show people it can be done and to show his commitment to spirit. So, Randy, I honor you for that, for whatever reason you do it. And you're the leading example. But I've had, through the years, I've had hundreds of people lose a lot of weight And I'm not a weight loss clinic, so don't call me to lose weight. If you come in and you've got lower extremity pain and you're overweight, I'm going to have you, hopefully have you do a ketogenic diet. It's easy, just protein, vegetables, water. Stay away from the carbs. It's easy enough to do. It's not a special diet. Just look up keto, K-E-T-O, on Google. You'll find it. I'm not here to counsel you on weight loss. I'm here to fix your joints and pain that you have in the body using regenerative medicine of platelets and stem cells. Make sense, Ray?
Excellent. It makes a lot.
All right, man.
Can I ask you one more really, really quick, brief question?
Of
in
course.
regards to insurance, I have really, really good insurance, and I'm not sure, do they cover stem cell therapy? I mean, I know that, they'll shell out $35,000 for a shoulder surgery, and then I'll turn around and say, something like, well, I want to try something different or new. And I know some of the treatments are not authorized. Is that changing?
Generally, health insurance does not cover regenerative medicine. Often workers' comp insurance will. And
right.
There are some Christian ministry insurances that I don't know the names of that often cover whatever you do. In these cases, you often have to pay for the treatment and then they reimburse you. So I'm not an insurance expert. You could call my office to find out more about that. And the phone number there is 800-300-9300. Okay?
Thank you, sir. I really appreciate all your time. Thank you for being so thorough. It's really, really
Thank you,
helpful.
Ray.
You're
a great man and great questions. And there's very good hope that I can help your shoulder heal up and your mom's back and your back issue also. I can't fix a fractured vertebrae, but I'm not even sure that's the problem.
Well, thank you for your call, Ray.
Everything I have. Thank you, sir.
God bless you, man.
Our number here in the studio is 866-870-5752. You can call us right now. Again, it's 866-870-5752. We have a few minutes left. I told you the hour goes quickly, Dr. Darrow, and so if you're sitting on your painful place,
Derriere.
That's the one, then, grab that phone because you don't have to be in pain for too much longer if this would work for you. I mean, you don't know unless you try, right?
I'm going to stump Nita now.
Oh, I can't
Nita,
wait.
why did the Clydesdale give the pony a glass of water? Because he was a little horse. One last one.
Okay.
You ready to laugh hard?
Yeah.
What did the policeman say to his belly button?
Oh, my gosh. I've
You're under a vest. You're under a vest.
Where do you get these? They're hilarious.
My patients give them to me.
Oh, my God. That is hilarious. That is
okay, I got to do one more. You ready?
Yeah,
Just
I'm ready. I can take it.
Why did the man get hit by a bike every day?
Oh, get hit by a bike every day? I have no idea.
He was stuck in a vicious cycle.
That is a good one.
Today with everything being politically correct, you can't tell real jokes. The real ones that are really crazy fun. But you can do these little
These are pretty funny. These are
you
great.
can do the corny ones.
Yeah.
And, you can get away with those. Doesn't hurt anybody's feelings.
I like it. Yeah, you should send these out in your newsletter or something, or put them on your site. They're pretty funny.
I just like to hear you laugh, Nita. That makes my day.
Thank you. Well, the funny thing is also that we need laughter. I mean, especially people in chronic musculoskeletal pain. You need a break. You need to laugh.
Well, everybody needs to laugh. My God. If you
Yes.
don't, there was a book that I had read. What was it called? Anatomy of an Illness.
Oh, yeah, Norman Cousins.
Norman Cousins. And he, when I was a lawyer, became my client. And one of his techniques, because he had some terrible illnesses, and he would check out of the hospital after a heart attack or whatever he had, and he'd go to a hotel and bring the equipment over there and have clowns come in and make him laugh hours a day. And he said that's how he would heal himself.
Wow.
So it's important to laugh. And I crack jokes all day long. My patients like it. They tell me jokes. My staff loves it. And it keeps everybody happy. Most people who come in go, this doesn't seem like a medical office. No, I don't want it to be a medical office. I want to be a place where people heal their pain. You know, you don't have to be a medical person to heal pain, right? So I like to cover both ends of it. Yeah, I'm a medical doctor, but I like to heal the spirit too. And that's, my point of view is you can heal the spirit. If you can help a person find the spirit part of themselves, they heal. And if they don't heal, at least they feel great about what they're doing. So I got a question that came. I want to grab this one before the end of the show.
Okay.
Do any of the involved procedures, bone marrow extraction and stem cell injection, require general anesthesia? No. And it's unfortunate because a lot of doctors will take people for these simple procedures that I do into a surgery center and put people under anesthesia and bill the heck out of the procedure. Huge amounts. To me, I'm going to just say it the way I see it. Sorry, guys, I think it's a ripoff. It doesn't need to be done. These procedures are very simple to do. I've been injecting people for over 22 years without any anesthesia. Okay? When you go under general anesthesia, you could die. I'm just saying it the way it is. Does it happen often? No. But if it's you, that's 100%. There's also all these drugs you get involved with that you don't want to have in your system. Why do that when you do something easy? Okay?
Yeah, we had a caller in December of 2019 that happened to her husband, remember?
Well, we're not sure what happened on that case. I do remember her name was Kathleen, and her husband woke up from a neck surgery and was on a ventilator. And she called up and said, what happened? I said, I really don't know. Did you ask your surgeon? And she said the surgeon came out after the surgery and said, I did everything right, and walked away. And that was her answer.
Ouch.
Yeah, he did die. It was a very, very sad case. And, I'm just going to say it the way it is in my experience. Most people that come in and say they're ready to have a surgery tomorrow or next week or next month never had to get those surgeries because we regrow the tissue and their pain goes away. They never needed to have the surgery. And this is not a bad statement about surgeons. I love surgeons, but I don't like the surgeries that they do in most cases. Shouldn't be done.
Well, it's an old paradigm. This is a new paradigm.
It really is. It's an old paradigm. Look at the MRI, find something that doesn't look right, and then cut it. It's not the way life works.
So
and
that's
I know
surgery
a lot of you
on
folks listening. A lot of folks listening right now have had what we call failed surgeries. That's why they're listening to the show. They had a surgery, it didn't work. I had one on my shoulder, it didn't work, made it worse. I fixed it, with regenerative medicine. I injected myself. I did great. So be very careful. Get a second opinion. If you've been to a surgeon who says you need a surgery, get a second opinion. Go to someone who does regenerative medicine using platelets or stem cells. See what their opinion is. If you go to a second surgeon for a second opinion, You're going to get the same results. Okay, it's end of the day for us. Go to www.lastemcells.com. You can watch me doing videos of these procedures. God bless you, Anita, and the staff. Thank you so much.
And remember to listen to The Pet Show with Warren Eckstein from 11 to 1 every Saturday, and we'll see you next time.
You've been listening to Living Pain-Free with Dr. Marc Darrow. Now that you've heard Dr. Darrow, you can schedule an appointment to talk with him in person by calling his office anytime at 800-300-9300. That's 800-300-9300. Or go online to lastemcells.com. Again, the website is lastemcells.com. Living Pain-Free with Dr. Marc Darrow is heard every Saturday at 10 a.m. and 1 p.m. here on AM 870 The Answer. Remember, to take the first step toward a pain-free life, schedule an appointment by calling 800-300-9300. That's 800-300-9300. Live long and pain-free. And thanks for joining us today.